March 2nd, Washington State Department of Health media briefing. I'm Nikki Ostergaard, your facilitator for this event. I'd like to welcome our panelists for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Tao Sheng Quanget, Chief Science Officer, Lacey Fehrenbach, Deputy Secretary for Prevention and Health, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, and Mark Henry, Radiological Emergency Preparedness Supervisor. To begin with today's briefing, we'll open up with remarks from Secretary of Health Umair Shah. Go ahead.
Great, thank you, Nikki. I want to, as always, thank my colleagues for joining this morning, and also thank our media partners for being here as you've been with us throughout this pandemic. And I know it's been a couple weeks since we've actually had a media briefing with Department of Health, but there's so much that has occurred over the last several weeks that we thought it was really important to hold this briefing today. I want to start by acknowledging Women's History Month, and I am joined, sorry, Tao, I'm joined by two incredible women on this, actually three. I'm going to include Nikki, obviously, but Michelle and Lacey. And I just want to say thank you to all the women in our lives and the incredible contributions that women make to and continue to make and have been making to healthy and safe, not just families, but communities. And I just want to thank both Lacey and Michelle, as well as Nikki and all of our teams and all women out there for just the incredible work that they do. This is also National Nutrition Month, and this is also National Disability Awareness Month, and we do plan on having additional activities during this this month to acknowledge all three of those different months of commemoration. I did want to, though, start with an acknowledgement of what's happening in Ukraine and the conflict in Ukraine, and recognizing that we have so many members of our Washington communities here in our state who have families or loved ones back home. And I really do want to just acknowledge just the incredibly difficult time this is for so many of our community members. Our hearts go out with and for them, and we also continue to stand in solidarity. And we obviously, from a health standpoint, always not just hope for, but pray for peace and well-being and health across the globe, not just in our state, but not just in our country, but across the globe. And I just want to start with saying that we continue to keep those in Ukraine and those impacted by this conflict in our thoughts and well wishes. We also understand, as we make our transition out of response and into recovery, our attention continues to shift to critical public health and humanitarian needs that are not just in our state or our country, but really, again, across the globe. And it's just a reminder of how important the real concept of prevention is, the importance of true health. And remember, the health is not, and peace is not just the absence of war. It's also making sure that we do everything we can to really build on the cornerstones of justice, and also ensuring that health and well-being are values that we all further in our everyday lives. I did want to also follow up on a couple of things, and then I'm going to keep my remarks very short, and I'm going to turn it over to Dr. Quanget, who's going to go through some of the epi information, which, as you know, we do every time that we have our DOH briefing. A few things have occurred over the last, it feels like it's been the last couple of years, but it's really only been a few days. As you know, the CDC revised its guidance for the data as they were looking at across the system in terms of what measures and metrics and indicators they were looking at to see how the globe, to see how the country was characterized in terms of high, moderate, low when it came to transmission risk and also community levels. And so I wanted to recognize that that was released on Friday. As you know, Monday, Governor Inslee and I and Lacey were on his press briefing, and we talked about the moving up of the mask, ending of the mask requirement statewide, and that would be after that the completion of March 11th. So starting March 12th, we would have the indoor mask requirements that were statewide that were going to be removed. And I do want to continue to focus on a couple of things. One is that, as I mentioned about hope and empowerment as we look ahead, but also that the data continue to be positive. And we actually had just last night a report from the Washington Medical Coordination Center, WMCC, and I want to thank Dr. Steve Mitchell and his group that have been with us throughout this pandemic out of UW Harborview. And it continues to show, again, across the state, both in Eastern Washington, Western Washington, what we're seeing hospitalizations stabilize and go down. And that is something that we continue to be thankful for. And it really gives us a lot of hope about the future. In addition to that, we're absolutely recognizing the importance of seeing cases come down as well. And when you bring in cases and hospitalizations, we're seeing a markedly better picture than the last time we had a DOH briefing with all of you. As you know, we aligned with Oregon and California to end our statewide indoor mask requirement. But at the same time, we want to just remind everybody that there may be additional restrictions or safety measures or protocols that local jurisdictions, local health officers, or businesses that may put in place in your local context. And we would just ask community members just to be aware of what's happening. As we've said previously, respect the rules of the room, know what those are, and then certainly be very patient and civil with each other as we work to continue during this difficult time for all of us. I want to also thank our local public health partners and our healthcare colleagues and our team in the public health system for everything they continue to do. And most importantly, I want to thank Washingtonians, because they have just done so much over the last couple of years to hang on with these difficult guidance and the tools that were put in place and the strategies and all the different and difficult issues and challenges that we've had. And I just want to say thank you for getting vaccinated. Thank you for wearing your mask. Thank you for using hand sanitizers and hand washing. Thank you for staying socially distanced. And at times, thank you for just partaking away from those activities that may have increased risk for yourself or others. This pandemic is far from over. Obviously, we still have a lot of work ahead of us, and we know that the next variant of concern may be down the pipe, and we're hoping we never see it, or we see it a long time coming. But at the same time, we have to continue to be ready and prepared for that. As Governor had mentioned on Monday, we're working alongside his team on developing what the next steps will look like for the future. And that plan is something, as you know, Governor had mentioned, would be coming in the coming days. And hopefully we'll have more information alongside him next week. But again, one of the biggest reminders from what we can all take away here is the importance of vaccines. And I do want to just recognize that Michelle is going to be sharing this, but we have achieved a vaccine milestone with 13 million doses of vaccines that have been delivered in the state of Washington, administered in the arms of adults and kids alike. And I just want to thank all, again, Washingtonians and all of our partners for working together to be able to do this. So again, we have absolutely had a challenging 2 years. We know the challenges will continue. We know there's a lot to unpack, and I'm sure you're going to have a lot of questions for us. We're prepared for really giving as best the answers that we can with a lot of continuing, changing, evolving information and a lot that's happened even in just the last several days. So with that, I want to say thank you again, and let me turn it over to Dr. Quanget, who will go through the EPI, and then Michelle and Lacey will work through both vaccines and additional guidance and information that we have. And then I'll come back at the very end before we go to Q&A. Tao?
Thanks, Dr. Shaw. Could we bring up the first EpiCurve slide, please? And while the EpiCurve slide is coming up, I'll just repeat Dr. Shaw's good news is that we continue to be optimistic about the direction of the pandemic in Washington. As we'll see, the key COVID-19 indicators that we follow are still high, but they're all moving in the right direction and decreasing rapidly. So this curve shows that cases, which still are all practically all from the Omicron variant, are now below the peak of the Delta wave that we saw last August and September. And this is certainly an undercount, as there are many people who test at home and test positive and may not get reported to the public health system. But even though it is an undercount, we feel confident that the trend is decreasing. The next slide, please. This graph shows that hospitalizations are also decreasing and are below the peak of the Delta wave and are comparable to what we saw during the downslope of the Delta wave during the latter part of last September. So as Dr. Shaw mentioned, our healthcare system capacity is increasing, and that's a good thing, but our healthcare system still is under considerable stress. Admission rates right now are still higher than what we typically see during a busy flu season, and hospitals are also dealing with backlogs in surgical cases and an ongoing high number of patients who are waiting to get transferred to nursing homes and other long-term care facilities for quite some time now, but haven't been able to find a placement. Next slide, please. Deaths have continued to be on a steady decline since mid-January, and that's very, very good news. Next slide. And as Dr. Shaw mentioned, vaccination remains the most important way that people can protect themselves. Next slide. Yeah, our data is continuing to show that people who are unvaccinated have hospitalization rates several times higher than those who are vaccinated. And so this is a graph of those 65 years and older. Next slide, please. And this slide illustrates that mortality rates are also several times higher in the unvaccinated than in the vaccinated. So the message is that even though COVID-19 rates are going down and in the right direction, they are still quite high, meaning that the risk of infection and severe disease is still a serious danger, especially for the elderly and children and adults with chronic conditions. So it's really important to still get vaccinated and boosted and get up to date on vaccine recommendations, especially if you are high risk or have family, friends, and close contacts who are high risk. And with that, I'll stop and turn things back over to Nikki.
Thank you, Dr. Quanget. Next, we'll go to Deputy Secretary Lacey Fehrenbach. Lacey, go ahead.
Good morning, everyone. Thank you for joining. I'm going to start with an update regarding our Say Yes to COVID Test program. The Say Yes COVID Test portal now allows up to 2 orders per household every month while our supplies last. Each kit contains 5 tests, so that's up to 10 tests per month for each household in Washington state. If you've already ordered from the portal, you can order again. Each kit must be ordered individually, so order once for 5 tests and a second order for 5 more following that. By mid-March, we will also have the Say Yes COVID Test website available in 37 languages, bridging an equity gap that we've seen for accessing free at-home test kits. I also want to note that we continue to distribute at-home tests to our partners in local public health and community-based organizations and tribes so that they can distribute them out to key vulnerable communities at the local level and people who may not have access to online technology or use our website. As a reminder, home tests are an excellent public health tool that help us know quickly and conveniently if we have COVID-19 so that we can take action to care for ourselves, protect our families and communities, and prevent onward transmission. So please make sure you have a box or 2 of at-home tests on hand in your medicine kit, and they'll be there when you need them. I want to remind people, as previously announced, that starting on March 12th in most public indoor settings, including schools, masks will no longer be universally required by the state. However, local officials, businesses, and organizations, including schools or childcare, may still require masks. Further, many people will still need to or choose to wear masks, as Dr. Kwanget mentioned, based on their own health status or risk tolerance. DOH is working to update a number of sector-specific guidances and requirements documents related to this change. And these include our guidance for K-12 schools and childcares. We expect to release updated guidance early next week, and we're working with leaders in those sectors and our partner sister agencies on making those updates. I do want to note that there will still be a few requirements, and that includes exclusion of people, staff, students, children who have symptoms of COVID-19, ensuring access to timely diagnostic testing, the isolation of people who are sick with COVID, and as always, reporting of cases or outbreaks and cooperating with public health in responding to those cases or outbreaks. The education employee vaccine requirement also remains in effect. Masks and most other measures like student vaccinations, distancing, ventilation, and screening tests will become public health recommendations and guidance. Schools and local communities will have flexibility to decide how to layer these measures in to best balance the needs to maximize in-person learning and attendance to childcare programs and limit transmission of COVID-19 among the school environment and community. As noted, schools and districts or local health officers may still require universal masking, screening tests, or other mitigation measures to limit transmission in schools or childcares, and that could be generally or in response to an outbreak or rise in disease within the community. And we encourage families and the public to respect the rules of the room you're in, whether that's a school or a business. Something that's not going to be changing with our guidance is our priority to maximize in-person instruction while mitigating the transmission of COVID-19 and the recommendation for layered mitigation measures, including masks and testing that help us stop the spread of COVID-19 in schools and childcares. School leaders, staff, students, our childcare leaders and staff have done a great job of implementing these layered measures over the past 2 years of the pandemic, and we expect that to continue as well as we move into this new phase. We also will continue to emphasize the need to protect those at greatest risk for severe COVID-19. That includes high-risk staff and students or children, as well as the families they go home to. And then lastly, all of us have to remain vigilant and prepared to pivot quickly if things change in our local community or statewide or the nation or globe. We recognize that this is both a significant milestone in our journey through the pandemic and also a really big change for schools, childcares, and families. I will say throughout this pandemic, I've been so impressed with how families, schools, and community leaders have come together time and again to keep their families and communities safer, and grateful for that, and encouraged continued grace and support as we move into this next phase and continue our journey together. Back to you, Nikki.
Thank you, Deputy Secretary Fehrenbach. Next, we'll go to Assistant Secretary Michelle Roberts. Go ahead.
Well, good morning, everybody. I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. As Dr. Shaw said, our state recently surpassed another amazing milestone. More than 13 million doses of COVID-19 vaccine have been given to more than 5.8 million people. That means nearly 81% of people age 5 and older have received at least one dose of COVID vaccine, and more than 73% are fully vaccinated. Every day, more and more people are continuing to further protect themselves by getting a booster dose of vaccine as well. So far, we've given out more than 2.6 million additional doses across Washington. And speaking of booster doses, later today, our COVID-19 data dashboard will update to show the number of people who received a booster dose of vaccine and those eligible for a booster dose. The data will be broken down at the state and county levels by sex, age, and race ethnicity coverage. As a reminder, everyone age 12 and older should receive a booster dose at least 5 months after their second dose of Pfizer or Moderna vaccines, or 2 months after getting the single shot of the Johnson & Johnson vaccine. Additionally, a third dose is recommended for certain immunocompromised people who likely did not adequately develop immunities with the initial 2-dose vaccine series. We know COVID-19 vaccines offer powerful protection against severe illness, hospitalization, and death, and boosters will extend that protection. Adding this data to the dashboard gives us a better understanding of who is staying up to date on their vaccines across our state. I also want to take a minute to talk about pediatric vaccines. More than 240,000 kids aged 5 to 11 have received their first dose of vaccine, and more than 202,000 are fully vaccinated. That means 35% of kids in our state have started their vaccination series that are age 5 to 11. Widespread vaccination is a critical tool to best protect everyone from COVID-19 and COVID-19 related complication. It's even more important as statewide mask requirements shift to recommendations starting next week. COVID-19 vaccines have repeatedly shown strong protection against the severe outcomes of COVID-19 disease. Vaccinating children age 5 and older can help keep them in school, help them safely participate in sports, play dates, and other activities that they enjoy. So it's never too late to start your vaccination series. So if you have not or you have questions, we encourage you to start today. To find vaccine locations near you, visit the state's vaccine locator website or vaccines.gov. If you have questions or need help making an appointment, we can support you in that. Call the state's COVID-19 hotline at 833-VAX-HELP. That's 833-VAX-HELP. Thank you.
Thanks, Michelle. Nikki, I'll just jump in really quickly before we go to Q&A. Just a quick question for Lacey. Lacey, one of the things that some folks have been asking us is about with the at-home tests about expiration dates. Some concern about 4, 5, 6 months down the road expiration dates. I know on the one hand we're asking people to hold on to these tests. On the other hand, how should people look at the expiration date? I know there was some consideration of extending those dates. So I wanted to just make sure if you could, and if you don't have the answer right off, feel free to hold off until the Q&A. But if you could just provide some guidance on that. That is a question that I've heard multiple times from people. And Michelle, just for you and for Tao, just a reminder that we have received a lot of comments from parents, and in particular around the mask requirements. And so, some of the concerns are really about kids, obviously, and in schools, rightfully so. And I wanted to just underscore 2 points. One is that many of us come as parents ourselves with kids in those very public schools that are obviously, we're also navigating the same terrain. But at the same time, we're also recognizing that we want to make sure that kids are able and free and the ability is there for them to continue to mask beyond March 11th. And that's really the message that I've been giving to people who have contacted me. I want to in particular mention that I had gotten a couple of comments, including a few comments, but including one on social media. And my answer is really very much about the fact that we absolutely continue to be concerned about the health and safety of our children, and absolutely also recognize that there are additional steps that we know that we can take to keep our kids protected. So Tao or Michelle, I don't know if you wanted to add any additional comments there. And then with that, Nikki, we'll turn it back to you and then we can go through the Q&A.
Yeah, no, I agree. Thanks for bringing that up, Dr. Shaw. As a parent, I think it's great that we have so many options to continue to protect our kids. Both all of us continuing to wear masks where we're in crowded settings, as we all individually decide. And then also too, really the power of vaccines, which is really the most powerful tool we have going forward in this as the pandemic continues. And that is the vaccines have repeatedly shown such strong protection against severe outcomes, including hospitalizations and death. And so that's why the power and the tools are here, and all of us can use them to keep our families and communities protected.
Yeah, and I agree. I think it's really important that we use all the tools available to us. And even after March 11th, masks still are really an important tool to prevent transmission of COVID-19. Even though we're fortunate that the vast majority of children who get infected with COVID-19 do have mild disease, still it can cause quite severe disease in children. More than a dozen children in Washington have lost their lives to COVID-19. In January, there was a death in a school-age child in Pierce County. And our hearts really go out to every family, affected by COVID-19. And so it's important to remember that really protecting those who are most vulnerable is really a collective endeavor. So masks just aren't about protecting you as an individual. It's also about what we can do as a community, what we can do as a school, what we can do as a family to protect those who are most vulnerable to severe disease from COVID-19. Thanks.
Thanks, Tal and Michelle. And I think we would all agree that we would ask parents to continue to have ongoing discussions and conversations with their children. And that is such a critical part of this, is to make sure that you stay connected, you know what's happening in the schools, and you also know what's happening with your child. And honestly, help your child through this very difficult time. This is not going to get any easier just because we're getting closer to the end of the school year. We still have several months to go, and we want to make sure that we continue to keep our kids protected. So Tal, Michelle, thank you for that. And Lacey, I think you came back off mute, so maybe you have the answer. So I'll turn it to you.
Yeah, so at-home antigen tests, typically they do have an expiration date. It's usually some number of months, maybe up to 12. You can usually find it on the back or the side of a box. On this box in particular, it's on the back. So these tests expire in July of 22. So you do need to, be mindful of that. The other thing is to store your tests in a room temperature, dry, low humidity environment, and administer them in a room temperature environment as well for best results. So check your packaging for your expiration date. And that really gets to the point of having 1 or 2 boxes on hand. In addition, while these are becoming more and more available, they still are a limited resource. So we do want to save some for our neighbors. So you don't need to go fill up a whole pantry in your house full of at-home tests. Just really have enough for your family. And as a reminder, in addition to our Say Yes COVID home test portal, the federal government has a site where you can get tests, and you can purchase these in pharmacies, and your health plan, most health plans in the US are required to cover a certain number of tests per month per member. So I believe it's 4 tests per month per member, 8. It's 8 tests per month per member. And so, buy them as you need them, but you do want to have a few on hand so that you don't have to go out if you're feeling ill, or, go on a goose chase to find tests when you need them. So do pay attention to the expiration date, and really just have what you need on hand.
Thanks, Lacey. So no extension of expiration date at this point. It's really about just having enough where you're planning ahead, so you have them, but you also don't have so many that you're taking away from others. Is that maybe the bottom line message? I love the visual, by the way, so thanks for grabbing those and having that. But is that in line with what you were saying?
Yes, when there are extensions that you have to, they're typically posted on the FDA's website, and you would have to go match like the lot numbers. So start with your box. I would start with your box. And then if there are particular tests that there are questions about, if reporters could follow up directly with us, we can do the back end research on that.
Perfect. Thank you, Lacey. And that just dovetails into the last comment about this, which is we're obviously, we heard the president's rollout last night in the State of the Union speech about COVID-19 and the measures that the federal government will be taking moving forward. And so we're really looking for the details of that. I'm sure there are going to be additional conversations this week and the following as we have with our federal partners related to that. I know that there is a real approach to a four-pronged look at the path ahead, protecting Americans and certainly against variants, and then doing everything we can to continue to move forward with our economy and our ways of life, but also working to help vaccinate the world. So I think there are many components that are in that, but we're just in case there are any questions about whether we have any specific comments right now, we're really waiting to learn more. I will say the test and treat option that the president mentioned last night is something that we are very interested in learning more about. And that was that if somebody tests positive at a pharmacy, that they would immediately be able to get antiviral medication. And obviously we don't have details about that, what that looks like, but that's certainly something that we are very interested in learning more about. So with that, Nikki, I think I've gone through all a bunch of questions that had come our way. So why don't we turn it over to you, Nikki, and we can go through the Q&A with any of our media partners.
Thank you to our panelists. This brings up our Q&A segment of today's briefing. First up, we have Ariel with the spokesman review. Ariel.
Thank you. I have two questions today. First, at what point will the pandemic become an endemic, and what markers or data are you looking for that shift? And then secondly, what is your response to immunocompromised people who feel like they are being left unprotected when the mask mandate ends this month? Thank you.
Yeah, thanks, Ariel. And I will say that this term endemic has been one that I've been careful not to use. I really. It's not that it's a bad term necessarily, but it's just that it has different meanings to different people. What really I'm focusing more on, and what we're looking at the department, is how do we look at the long term, and how do we learn to coexist where we know that COVID-19, the pandemic itself, or this virus itself has not gone away. That it is still something we need to be thinking about, but at the same time, how do we live our lives while we also keep an eye towards or think about safety and health and protections? So, doing both are not in contradistinction to each other. You can do both. But when we look at the indicators or the measures, that's actually what we are right now in active discussion on, and what that is going to look like for us as a state, and what we believe from a public health standpoint are the most important measures. Now, remember, CDC has forwarded what they're looking at in terms of both community transmission and also what's happening in, and more that emphasis of what's happening in the healthcare system and healthcare capacity. And certainly that's something that we're very, very, obviously very, we feel are very important indicators. But at the same time, there are other indicators such as vaccination rates, and where vaccinations are more, the rates are higher versus other places where the rates are lower. So thereby you don't have the protections, as Tao had mentioned earlier when he showed the graphs. I mean, there's some things that we really do think are important that we need to continue to monitor. I think the key message for us, though, is that as we look at this longer road ahead, it's really about making sure that we're doing everything we can to continue to have the resources available as best we can, because obviously the the resources will not be at that level as it's been throughout the pandemic, but the best we can to really make sure that everybody in the state of Washington who does not have access to things like PPE, masks, et cetera, or tests or vaccines, that we want to make sure that that awareness is there and how they can actually access it is really important for us. As far as immunocompromised people, I would say that no one should feel that we are leaving anybody behind. We really do believe very strongly that that these measures that we have continued to put in place and we have focused on since day one in terms of protecting not just health and safety but lives, that those measures will continue. Certainly if people want to continue to wear masks, we are going to continue to support them. We absolutely want to make sure that people are testing when it's appropriate. We also want to make sure people are vaccinated and boosted when eligible. And so those are probably the cornerstone of how we continue to protect ourselves and those around us. And we really just want to make sure that people are thinking about others. And I think both Lacey and Michelle, as well as Tal, mentioned this, that it's not just about us, it's also about the people around us. And how do we do what we can to help protect those around us? So Tal, Michelle, Lacey, anything you want to add to any of those two comments, two questions, and then we can turn it back.
Yeah, thanks, Dr. Shaw. Yes, with regards to endemicity, as Dr. Shaw mentioned, there's really no single indicator that defines when a disease is endemic. Endemic means that an infectious disease continues in a population without being introduced from outside that population. And so endemicity doesn't really say anything about severity of disease. So for instance, flu is an endemic virus, yet every year flu kills thousands of people. So really what defines whether COVID-19 is endemic is just time. As the months, as the years go by, will COVID-19, will SARS-CoV-2 continue to be present in our communities? The other thing that I'll add to Dr. Shaw's comments about immune compromise is that it's very important for those with chronic conditions and immune compromise to stay in touch with their physicians, and if they have symptoms of possible COVID-19, to get tested and then to discuss with your physician whether one of the available antiviral medications or monoclonal antibodies would be appropriate for you, because these medications are able to reduce the risk of hospitalization and death. And while supplies initially were quite low, they are increasing. And I hear that we do have medications in our pharmacies that haven't been used and that could be used. And so it's important for people who are immune compromised or with chronic conditions to know that that's an option for them should they fall ill with COVID-19, and to talk about it with their healthcare provider. Thanks.
Ariel, did you have a follow-up?
Nope, that's great. Thank you.
Thank you. We'll move to our next reporter, Kate with KUOW. You should be able to talk.
Yeah, thank you so much for taking the time. I appreciate it. Just wanted to ask about the role that contact tracing will play as we move forward into this next phase of the pandemic. How important do you think contact tracing will be in this next phase? And how do you think the state is doing on that front, considering that the really small percentage of people who are being contacted at this point?
Yeah, thanks, Kate, for that. And I will say a few things, then I'll turn it to Lacey and perhaps Tao if they want to add something to this. A couple of things that, first of all, that contact tracing has been an effective tool in a number of different disease activities globally and domestically. And so in particular, it has been used in other infectious diseases such as tuberculosis and other areas where it really does look like you have an ability to know someone who has been infected, the people that they have been in contact with, and in a very quickened pace able to make contact with those individuals and essentially protect others so that you interrupt transmission. So that's the concept, Kate, as I'm sure you're aware. With that in mind, though, you have to remember that contact tracing is a part of an entire system. And it starts with somebody who has a symptom or somebody's been exposed and they have a test that comes back positive. So that implies awareness and implies testing. And as I've said before, you can't trace without a case. So once you have a test that's positive, now that individual becomes a case. And that when that individual becomes a case, then we do case investigation. So we have to then interview and talk to that person to be able to really move forward with what we're trying to do to protect that individual. And because we're taking a population health perspective, it's not just that individual, but it's the population at a whole. And then on top of that, that's where contact tracing comes in. Any of the context that that individual has, and how do we move forward with making contact with those individuals. Now, the one thing that I would say about the state of Washington, and we should all be proud of, is our WA Notify, our real technology tool that we have used and utilized. So it has lessened the human interaction need, where we have somebody, and we've gotten a lot of people, especially during Omicron, that were telling us that they had gotten an alert on their phone, and that said that, look, you may have been exposed. And at that point, that individual has some information that allows them to determine what that exposure is, what their concern for risk is, and to get tested, and further, if they have symptoms, to isolate away from others. So there's a lot that goes into this, and we're really hoping that for the future that we can continue to focus on not just the human aspect of it, which is always the critical piece, but the technology aspect, which will also allow for that work to be done. So I think in the future is really contact tracing is there. But I would say that one thing that's really important as we move forward, both in case investigation and contact tracing, is we're looking at focused populations where we are very concerned about maybe either vulnerability because of some other medical condition, or outbreaks, or age, or certain settings, congregate settings. That's really an area of focus. And then certainly doing everything we can from that to be able to make sure that we are helping interrupt that transmission or furthering of that outbreak. So that's really where the focus is going to be more and more, where it's more empowerment of people so they have information on what they can do individually, while we're also focusing more on those most vulnerable and or those that are part of outbreaks. And that's really, I think, where we're going, and then using technologies along the way. So Lacey, this is an area of focus for you. So, I know you and Tao may have some additional thoughts.
I think you covered it really well, Dr. Shaw. I think the one thing I would add is for people who do test positive, you can notify people in addition to using WA Notify. So notifying your work site or your school, if you go to school, friends and family that might have been exposed, and encourage them to get tested. And of course, you can report your positive result to our hotline. And if you need support to help you isolate, or you have questions, you could call the hotline, 1-800-525-0127. Again, 1-800-525-0127. And there is language assistance available. And we will connect you to resources if you need like a food kit or care kit or other resource to help you stay home during your isolation period.
Tell anything? Yeah.
Thanks. Yeah. Yes. As folks have said, I think the focus of the public health system will really be on those individuals and settings where there's an increased risk for transmission. So settings like homeless shelters or jails or long-term care facilities. Outside of those, it becomes sort of a community responsibility and something for all of us to be thinking about. As Lacey said, if we know of a coworker or a friend who has a chronic condition or is immune compromised, and we learned that our friend might have been exposed, and it's really important to let that person know. So Yeah, so the emphasis for the public health system will be on those high-risk individuals and settings, but I think it's something that that we as a community need to continue to embrace. Thanks.
Thank you. Kate, did you have a follow-up?
No, that's good. Thank you so much.
Okay, we have 8 minutes left and 3 reporters left in the queue. Next up is Nicole with Cairo. Nicole, you should be able to talk. Nicole, we can't hear you. Are you able to hear us? Okay, we will move on to Elise with the Seattle Times. Elise, go ahead.
Hi, good morning. Thank you so much for being here. I just wanted to ask for a little bit more clarification on the CDC's new classification of some Washington counties for some readers who are still a little confused. So some counties, for example, particularly it looks like more rural ones, appear to have a lower 7-day case rate, but are still being classified by the CDC as being kind of high community levels of COVID. And so is that because they have lower numbers of hospital beds, or what kind of role does the bed number also play in the CDC classification?
Yeah, Tao, did you want to take that one?
Yeah, sure, I'd be happy to. Yeah, the CDC devised this new system of community levels to try to come up with a way to give communities an early warning if increased hospitalizations or deaths are anticipated in a few weeks. And so they arrived at a combination of indicators that includes transmission in the community, as well as hospitalization rates and the percent of patients hospitalized with COVID-19. And so, so data from hospitals is a really important part of the new community level system. And so our team is working with CDC on clarifying their data sources, and we're working on being able to reproduce the CDC maps with our internal data that's more updated and more frequently refreshed, and hopefully that will be helpful to communities to measure their risk.
Elise, did you have a follow-up?
Yes, thank you so much, Dr. Kwanget. That's helpful. And so does that mean that for some counties, if they have a lower number of hospital beds, that they could remain in that red state classified by the CDC, even if actual infection and community transmission rates are low?
Yeah, that's a good point. And the way the CDC assigns a hospitalization rate to a county is they take a look at the hospitals that serve that county. And so that could be a hospital in another county or maybe even another state. And they look at the health service area serviced by each hospital, and then allocate a certain fraction of cases to the counties and states that are served within that health services area. So, so even though a county may have a few hospitals or no hospitals, still hospitalization data is still used from these health service areas established for the hospitals.
Yeah, and Dr. Kwanget, just adding that's one of the reasons they're looking at both rates and capacity numbers rather than just sheer, numbers of beds, but really what the proportion is of people that are in those beds, staff beds, versus the availability of those beds. So I think it's doing its best to really look at capacity and also look at some rate on top of it. So it's not just a sheer number issue. Yeah. Great. Nikki, back to you.
Thank you. Our next question comes from Claudia with Everett Herald. Claudia, you should be able to unmute.
Hi, thank you. I had a follow-up on Kate's question regarding contact tracing. It's my understanding that the state had this initial goal to contact the vast majority of infections, and only a tiny fraction of that is being met. I'm just wondering if this is concerning to you all, and if it was a result of the state just being overwhelmed by cases, or if we should be interpreting that as a general shift in Washington focusing its resources on high-risk settings like you discussed. Thank you.
Yeah, Claudia, if I could just add, and then, Tao or Lacey, let me turn it to the two of you. I just wanted to add one thing, which is we do believe that as we continue to get testing out to people, so decentralizing testing, which essentially means empowering people, they have the tools, as Lacey showed with the COVID tests that people will have in their own homes or have readily access to. We're going to see less and less in the public health system those test results. And what we want to do is to be able to give people the information on what they should be doing if they get a positive test, and for that matter, if they get a negative test, right? Even a negative test is important information. But if they get a positive test in particular, that information is important then from a standpoint of being able to take individual action. And so what we are also recognizing is that here's the byproduct of that: as you get more and more tests out to people, you get less and less of the picture in quick time, within some X days of a test that's coming back positive. And in fact, unless that individual reports, you may not get that test result for a long time coming, or you may never get it. And so we've got to then be thinking about what does that mean for us from a public health standpoint, and shifting away from necessarily everything that we're trying to do to do contact tracing or case investigation, and recognizing that as we get more and more tools out to people, that we will then have to be really relying on those individuals to take actions that are going to be protective for themselves and those around them. So I think one other thing, Claudia, if you can just keep in mind, is that as we're, as a system and as a country and as a public health set of looking at the road ahead of coexistence, that as we decentralize and move that empowerment to people, it really does give an opportunity then for us to be less focused on outside of those really vulnerable or congregate or outbreak type of settings or scenarios, that we're really then at that point where we're doing everything we can to to just get information to people so they know what to do. So Tal and Lacey, I don't know if you wanted to add anything on contact tracing as a concept for us as we move forward as well.
Sure. Yeah, I think another thing that I'll add is that the Omicron variant really made us realize the limits of contact tracing. The Omicron variant was so transmissible and so quickly transmissible that it really stretched the limits of our ability to respond with contact tracing, both because there were just so many cases, it was impossible to keep up with the volume, as well as it was spreading so quickly. Often by the time an investigator might get hold of a person who was reported, say on the second or third day of illness, many of their contacts would have gotten ill already. And so the ability of contact tracing to interrupt transmission was much, much more difficult because of the Omicron variant. Thanks.
Our next question comes from Esther with KXLY.
Hi, I just have a few questions for Mark. I'm kind of going to shift gears to the work you're doing as the Ukraine invasion mounts. Just kind of catch me up to speed on how things have changed for you and what your role looks like as we, watch this war that's on the other side of the world, but you are preparing for public safety here.
Well, thank you for the question, Esther. So in things changing for us, our office of radiation protection, constantly monitors the environment. And we're also around different facilities such as the Hanford Reservation, the nuclear power plant, naval facilities, and certain radioactive material licensees. We're constantly monitoring air, soil, water, milk, any edible vegetation or inedible vegetation. And we're constantly working with our federal partners, Environmental Protection Agency, U.S. Department of Energy, Department of the Navy, to make sure that those samples all have the same results. So in light of Ukraine, we have not increased that sampling, but we have coordinated with our partners and internally to make sure that all our equipment is at a state of readiness, that we have all the supplies that we need, all the individuals that we know we would ask to go out and actually do environmental monitoring are prepared to go out and do that. And then we are monitoring any intelligence and any information that we could get through the news. And that would be because depending upon the event, whether it was an attack on the Chernobyl facility or it was an attack on an operating nuclear reactor or say a tactical nuclear weapon, that response is going to be different. And we have to tailor what we look for in the environment to that response. Does that answer your question?
Yes, that's helpful. And then as far as any concerns, do you just want to say any messaging that you feel like our state would be prepared just to calm any concerns viewers have, or should viewers be concerned? I guess how should they feel kind of watching what's happening, but knowing that we are stable and ready for if a worst case scenario came, you guys feel like we are prepared to the best that we can be?
I would say absolutely we are prepared to the best that we can be. We were actually prepared to the best that we can be when Fukushima occurred. And when that did occur, we set up a phone bank that included not only media professionals, but it included subject matter expertise so that we could handle phone calls and email inquiries, share our data with what we were finding in the environment, and explain what that risk was to the public. I myself manned those phone banks quite often. So I handled quite a few calls. And I have to say it was one of the most rewarding jobs that I have ever had in response, because I actually got to sit down and visit with people who had a respectable fear for what might happen and explain to them why they could be comforted, why we weren't going to see a risk from Fukushima. So in light of that, I feel that we're even better prepared right now than we were for Fukushima.
Mark, first of all, thanks for being on. I was going to turn to you before we closed because you had your camera off the entire time, but I want to say thank you for the tireless efforts. Our environmental folks do so much work behind the scenes and stay ready. And, I think it is the adage of you hope for the best, but you plan for the worst. And I think that is absolutely where we are. And so really, I think it should be comforting to Washingtonians that you're on the job and you're doing it day and night, weekends and holidays, and the unsung folks behind the scenes that are doing that every single day. So just want to say thank you, especially during these challenging times. And it's not just radiation; it's also we're also monitoring cyber type of systems as well, and just making sure that we continue to just be as safe and protected as we can as we continue to serve the public. So thank you, Mark.
Thank you, Dr. Shaw. It's a real honor to serve the people of Washington State. We enjoy that very much. We take it very seriously.
Appreciate it.
Our last question, we're going to try and return to Nicole with Cairo. Nicole, you should be able to speak.
Hopefully this works better. I'm on my phone now. We all went back to the office and I guess my office computer doesn't let me talk into Zoom. The State Hospital Association says that we should really keep our masks on when we're indoors in public spaces for a couple more months. They say just based on what they're seeing inside the hospitals, they want to protect the immunocompromised, and they say really it's a small ask from all of us to keep doing this. What is your response? And then additionally, at what point do we all need a fourth shot or a second booster?
Yeah, Nicole, I think, and I will obviously ask Tao and Lacey if they want to weigh in on this as well. And Michelle, I'll let the vaccine question come your way. What I would say is that, March 12th or the end of March 11th really marks the end of the statewide requirement. And it does not mean that local jurisdictions, local health officers, or businesses, or individuals may decide that they want to be more protective or more careful, that they want to continue to wear masks as individuals, or that a business or a locality may decide that they want to require masks as they continue on with their activities in their communities. And so I think what we're really signaling is a statewide change that's occurring from a state level. But that does not mean from a public health standpoint that we do not continue to support the fact that masks work, the fact that vaccines work, the fact that testing works, the fact that social distancing works, the fact that hand washing and hand hygiene works, the fact that ventilation and appropriate look at indoor versus outdoor activities, or crowded activities versus uncrowded activities. All of that works because we have shown it for the last 2 years. But it's ushering the end of the March 12th of this statewide indoor mask requirement. And so I think that's what I would say to our colleagues. And we have been very supportive of what's happening in our healthcare system, our hospital system. As you know, as we've had multiple surges, we have done everything we can. The governor has made it very clear. We have worked as a state with all of our partners, with the Healthcare Authority and Department of Social and Health Services and other partners, including with emergency management and the Guard, all sorts of partners at the state level, to do everything we can to continue to focus on our healthcare system. And that is, really the important piece for us, is that if a surge, and let's hope it doesn't happen, occurs again, we're ready to do that. And we will continue to stay focused on protecting Washingtonians. So at this point, it's the statewide indoor requirement that goes away. That does not mean that we don't continue to encourage people to be smart about what they do in certain settings and certain contexts, especially as certain individuals, as you said, immunocompromised, may have additional reasons that they want to continue to protect their health as well. And we want to help protect their health also. Tal, Lacey, anything you want to add?
Thanks, Dr. Shaw. I think one thing I'll add is that the work that Washingtonians have done to wear masks, to practice social distancing, to get vaccinated has worked. Our state has, I think, the 6th lowest cumulative death rate of all the states, and that's because Washingtonians have stepped up to the plate. And as Dr. Shaw mentioned, just because after March 11th, the law requiring indoor masking is going away, all the good reasons to wear masks, to decrease transmission in community, to protect those who are most vulnerable from infection, severe disease, all those reasons are still present. And so I think it becomes important for us as a matter of community responsibility, not before, while it might have been a motivation for some might have been to obey the mandate. Now the real motivation is our community responsibility to protect those who are most vulnerable. Thanks.
Lacey, anything? Are you good, Lacey?
I mean, I think Dr. Kwanget summarized it really well. And I said earlier, I've been so impressed throughout this whole pandemic how communities, private sector, public sector have come together, in really creative and innovative ways to move through and support each other and keep their community safe and our state safe. And, I hope that we will continue to do that as we go through this journey, because we are going to be dealing with COVID for months and years to come. And we're going to face other threats as well. So, on masks specifically, there will be people who will still need to wear masks. There will be people who will choose to wear masks because they want to protect their family, they want to keep schools open and their kids in classrooms, and they want to protect our healthcare system. And those are all great actions we can take as residents of this state and caring community members.
Thanks, Lacey. Michelle.
Yeah, and I can jump in and answer the second question you had, Nicole, which was a great one about what do we think will be coming in the future about additional doses of vaccine. And I think we don't have that answer yet. I think we'll see a lot more clarity probably in the summer and early fall on that question. We're really learning in real time about what the right dose of vaccines, how many should be in a series of vaccines for the best protection, is there any changes in protection as we have variants of vaccines, and what really is the right timing for between doses of vaccine. So what I can say is that the manufacturers are doing studies right now, looking at a couple of things, looking at additional doses of vaccine, and including looking at studying potential booster doses against Omicron to really understand what may be additional, the benefits, the protection, any potential risks from additional doses of vaccines. And I think we'll see that data come out late summer and into the fall, and will help us determine if and when additional doses of vaccines will be needed and available.
Thanks, Michelle. Nikki, I'll maybe just say a few things, then I'll turn it back to you to close. I just want to again thank our fellow panelists all for being here this morning, as always, for continuing to do what you can to get good information out to the public. I want to thank our media partners for, again, every week being with us throughout this pandemic, and just being so important to getting information out to our community members. Thank you again for all the work that you do. And I really just want to remind everybody that, you know, this is all hopeful news and good news. And as we continue to see cases and hospitalizations come down, we want to continue to see that trend. And we want to continue to encourage people to, yes, go on with your lives, and yes, do all those things that you enjoy, and yes, do all those things that you want to do with your family and friends, but just keep health and safety in mind. You can't always control what others are doing, but you can absolutely control what you're doing and be a part of the solution to continuing to protect yourselves, your loved ones, and certainly your broader community. It has worked in the state of Washington, and I do think that, as Tal mentioned, in terms of our ability to protect lives and save lives, that is something that we have continued to focus on, and we will continue to focus on even moving forward. Again, this is a hopeful time for all of us, and we continue to look for this to be hopeful for the people of Washington. We want to continue to keep in mind that this pandemic is not over. We have a lot more that's still ahead, and not always certain what that path ahead is, but we're going to be ready. And as Mark has said, that, you know, we will always be ready to serve Washingtonians, and that is what our commitment is. And then the final thing I would say is that we do continue to keep our communities that are impacted by conflict across the globe in our thoughts and well wishes. And we do hope that we can see peace sooner, so that we can all get back to focusing on other things. So with that, just want to say thank you again. And we will likely have, I mean, our next scheduled one, I believe, is 2 weeks from now. We may need to make some adjustments with some scheduling. So just wanted to let our media partners know that we'll get, obviously, word out in advance so that you're aware. And with that, we will turn it back to Nikki. So thank you again, everyone.
Thank you, Dr. Shaw. This concludes today's media availability. I'd like to thank our panelists for their time today, and TVW for hosting today's live stream and archives of past briefings. Thank you, and have a good day.